Hey guys, happy Friday. Welcome back. We're back with Facebook Fridays now. Spring Fling is now over. I guess today is the last day for those specials if you're interested. But we're back again every Friday now. And today I'm really excited about this procedure we're doing today. We're doing BioTE. I know a lot of you might have saw that or have been hearing a lot about BioTE, but it's brand new to the area. I'm really excited to show it. I actually saw it one other time during training, so I'm excited to kind of get it up and close and personal. We do have a patient today. She has consented to have the procedure done, and we're going to talk about BioTE pricing, what it is, who's a good candidate for that, and it definitely can change your life. So if you guys have questions, make sure you comment them. Kelly, our nurse practitioner here, is doing that procedure today. She does most of them at the Center Yourself Center PC. And any questions, again, comment below. She'll be more than happy to answer them. So here we go, BioTE. Good morning. How are ya? How are ya?
Good.
You excited?
Yes.
Good. All right, Kelly, we're here today. We're learning about BioTE.
So BioTE, we're talking about hormone replacement. So basically, when we're talking about hormone replacement, people get concerned. You know, they've heard about the Women's Health Initiative, the study done in 2002 when they talk about estrogen replacement. And that's the study that scared a lot of women because it came out and said that estrogen causes breast cancer, that it increases your risk for blood clots and stroke and heart attack. But that study only looked at estrogen, the synthetic estrogen. It didn't look at bioidentical estrogen. When we say bioidentical, what we mean is this bioidentical is what occurs naturally in the body. So these pellets are molecularly identical to what your body would produce on its own.
So are we saying this is like another version of organic? Like, I know a lot of people know the word is organic, natural. Okay.
So basically it has none of those type of side effects. And actually the research has shown that estrogen is actually protective of the bone, breast health, it protects against breast cancer, brain and heart, cardiovascular health. So it actually protects against all of those things. And the same thing, you know, shown benefits with testosterone in women. Women start to lose testosterone in their 20s. You know, the increased, you know, belly fat, the mental fogginess that comes along with some of that.
I've got it all.
Right, inability to lose weight.
I've got it all.
Right, kind of can go right down the checklist.
Right.
So when we talk about optimizing your hormones, that's what we're talking about with BioTE and hormone replacement therapy. So and there's, you know, over 400 functions of estrogen alone in the body. So when we look at your symptom checklist here that you filled out.
So every patient, you guys, just to let you know, every patient before we do have their blood drawn, they go through the symptom checklist. Right. And we want to make sure that they have these symptoms before we even draw their blood.
Right. So we're talking about, you know, when we look at depressed mood, fatigue, memory loss and confusion, decreased libido, sleep disturbances, we look down the list at hot flashes, night sweats. There's a lot of overlap with a lot of these hormones. So, you know, the irritability, those sorts of things, the hot flashes, that's going to come from estrogen or lack of estrogen. Things like the mental fogginess, inability to lose weight, bloating and weight gain, some of those things are going to come from testosterone. Then there's thyroid that you add into that, where you're looking at, you know, night sweats, again, the mental clarity, mental fogginess, fatigue, that sort of thing. Thinning hair can be one of them. Dry skin, cold intolerance, those things are going to come from thyroid, but there's a lot of overlap between all of these hormones.
And this is for the female version, and there
Right.
is a male, so I'm going to, oh, that's not on here, sorry.
Right. So when we look at your symptom checklist, you know, a lot of these things are things that we can help correct. So then we do your labs. So looking at your lab results, we see here. So looking at your thyroid, so you're at 2.43. That would be considered in the normal range. However, you're still having symptoms, so we would say that's not optimal. So we would like it to actually be at like 0.4. And TSH is not actually a measure of the active thyroid in your body. We would look at T3. You're at 3.1. our recommendation is that you're at 4. So I would even consider replacing your thyroid. Even though if you would tell like a family practice or general practitioner, they might say you're in the normal range, I wouldn't treat it. You're not optimal because you're still having symptoms. So that's one thing I would recommend that we replace.
I just want to point out, you guys, Kelly just made a really good point. So a lot of when you guys come and you're like, oh, I know my thyroid's off. Well, physicians will say, oh, you're normal. But with BioTE and the hormonal pelleting, it's usually not normal. So Kelly's here to help, fix a lot of those symptoms for you.
So here, your FSH is 64. That's where a lot of your symptoms are coming from. Anything over 23, that's where you're going to have the symptoms, the hot flashes, night sweats, mood irritability, that sort of thing, depression. A lot of that is going to stem from that. That's where we feel crummy in menopause, is because our FSH is above 23. So that's something where I would replace the estrogen there.
Oh, good Lord.
So, yeah. So that's why we repeat our labs. So once we pellet, we repeat labs in 6 weeks for women, 4 weeks for men. If at 4 weeks you come back or you call me and say, I'm not feeling any better, I'm still having hot flashes, I'm still irritated, I still want to kill somebody, then I would have you come back in early at about 4 weeks and we draw your labs early, because you may need a little boost of estrogen. So I may have to give you a little bit more. Sometimes we don't always hit the mark, but most often we do. So that's something that we talk about too, that we follow up with this. Once we pellet you, we follow up and make sure we've hit our mark and where we need to be and your symptoms are relieved. So I would replace your estrogen there. Looking at testosterone, you're at 22. Females should be between 150 and 250.
So super low.
So I would recommend testosterone as well. And when I say that to women, they're like, wait a minute, let's pump the brakes. Am I going to come out with a beard and a deep voice, and am I going to be like on roid rage? That's not the case with this. With pellets, you get a nice steady state of hormone. It's not like the injectables that men do, the anabolic steroids, where they get this roid rage and they're cycling up and down. The side effects, most common, are very temporary and treatable. So they occur less than 2% of the time, and it's just as your body is getting used to that level of testosterone in your body that you haven't had previously. Most commonly, it's fluid retention. So if you have swelling in the hands or feet, that you're like, okay, you call me a week to 2 weeks, and you're like, what is going on here? We put you on a low-dose diuretic until that passes, or until your body regulates to your testosterone level. Some women may have a breakout of acne if they were prone to acne prior to treatment. Again, we would place you on some doxycycline to clear up the acne, and then we go on. Very rarely do you see any type of facial hair growth with women. It's a very rare side effect with women.
Well, that's good.
So, so I just want to, because always when I say I would replace your testosterone, the women are like, wait a minute.
But that's the thing, is women, I don't think, understand they already have that in their body. So that's something that we want to make sure you're at the optimal level that you should be at.
Correct. So then we look at your vitamin D level. You're at 24. That's extremely low. So I would also recommend that we replace your vitamin D. And anytime you're replacing vitamin D, you have to give it with vitamin A and K. Otherwise, it's not going to absorb, and you're not going to get the benefits from taking it. So we recommend an A, D, and K supplement. That, again, it goes together. Another supplement that I would give you if I replace your testosterone is something called DIM. It's actually testosterone, the way it's metabolized in the body, it's along 2 different pathways. So the first, it's metabolized into estrogen. And so we don't want that to happen, because we're replacing your estrogen. We want your testosterone to stay as testosterone. So we give you that DIM to block that, so it doesn't go down that pathway and it stays testosterone in the body. So that's another oral supplement that I would recommend.
So we do have a question. Someone wants to know, could a factor of weight loss, or could that be a factor in which weight loss is harder?
Yes. Oh, yes, for sure. With testosterone, a lot of women that I see, they work out 4 or 5 times a week. They eat right. They bring in their food journals, and they're like, "Look, this is all I eat, but I can't lose weight. I can't. I'm gaining weight steadily."
It's a battle.
It is, and it's because we're low in testosterone. So we have that belly fat that we just can't get rid of, and we're not able to lose weight, and we're not able to get that lean muscle mass that we want. So it's a factor of testosterone. I had a patient that I just pelleted probably 10 weeks ago. She came and saw me yesterday for repeat labs because she's getting ready to repellet. She said once she got her testosterone, she lost 21 pounds.
No.
So she said, and she was doing everything right. So you have to maintain diet and exercise for all of this to work together. But they're seeing the difference. They're seeing the payoffs with
It's like a miracle.
Exactly. So we don't tout this as a weight loss tool, but it is going to optimize you so that in combination with diet and exercise, you can do it.
No, I might be a whole new me.
Right. You'll feel a lot better. All right.
So could we do a recap of what you're getting today?
So we're going to replace estrogen and testosterone in the form of pellets. So when we talk about the pellets too, they're about the size of a grain of rice. They're very small. The procedure, they're implanted underneath the skin and subcutaneous fat in the gluteal region. It's very quick procedure. It's often painless. The most you feel is the initial anesthetic. But a lot of my patients have said, I didn't feel anything. They're surprised when we're done. And then probably every 3 to 4 months, depending on the person, is when you come back to get repelleted. We talked briefly that you would get repeat labs at 6 weeks. And that kind of tells us if we've hit our mark. And then I tell people, if it lasts 6 months for you, that's okay. You're going to set the frequency for when you need to come back and be repelleted. So for example, the hot flashes are the first thing that goes away. That may be the first thing that comes back then when you know you need to get repelleted. So when you start having to use the fan at home again and you're having the hot flashes, you say, okay, I think it's time I need to go back and have some more pellets. So that's what I let the patients set the frequency. Somebody that's very active, they're a marathon runner, they're going to burn through their pellets a little bit faster. They may have to come back in 3 months because it's based on cardiac output and how much blood flow is through the area. We talk
I'm
about
no runner, so
that's okay.
mine are gonna last.
There's all different sizes and shapes that we pellet, all
Right.
different ages. So then when we talk about post-care, so after you're pelleting, you need to rest the area, so no exercise to the gluteus area for 3 days. You're going to have a dressing on there. You can take the outer dressing off tomorrow, but the steri strip that's on there, it has to be on there for 3 days. And no submerging in like a pool, a hot tub, bathtub for 3 days after the procedure.
Okay. Yeah.
So any questions?
No, I think you've explained it very well.
I have a question on Facebook. They want to know what is the earliest age you can be pelleted.
I think there is. There's a hard age limit. I think it's at 25. It's just kind of dependent on the person and symptoms they're having. Sometimes we can treat with just nutraceuticals alone and not pelleting. So if somebody has ever had a question or they just want to even schedule a consult, that we can still do that.
Okay. Awesome. All right, so I'm going to do a brief little overview again of what Kelly's going to do, and I know she's going to get her patient prepped to show you the procedure. Okay, so
Facebook's not streaming. Red's
it's live, so I have
Okay.
questions, so I guess we're streaming. She said, "You go, girl. I'm next."
Who said that, Miss Lane?
No, but Renee said that.
Oh, Renee. Yeah.
Ah.
Hi, I'm gonna lean you back.
Okay.
Wait, do you have the checklist again?
Your feet are gonna come up.
So I'm going to show you guys that checklist again that you would that you guys may see here. Okay, so some of the things here again is depression, fatigue, memory loss, mental confusion, weight gain, bloating, migraine, sleeping problems, decreased sex drive, joint pain, swelling, cold all the time. I mean, all of this can be symptoms that we can help achieve the results you're looking for. Again, but this depends on each person, so each individual, it's customized depending on what you need, and that's going to come from your lab work. Now, this is for the female. The males is a little different, which I'll show later. It's also on our website at thecenterpc.com. But you can see again here, like if you feel like you're going through menopause, hot flashes, this is a great for you. This is going to be fantastic. And again, this has to do, so what you do is that if you're interested, you can give us a call. We can either do your labs here at the center, and that would be $150 if you're interested in the labs. So Stephanie, Jessica, Levine, we can all drop your labs here. Or if you'd rather go through insurance, that is another thing. We can get you set up with your either Quest or LabCorp or whatever laboratory you want to go to, and we can get that paperwork for you for your labs. So that's $150 if you want to have your labs drawn here, or we can send it out through insurance. Now, regarding the price of the pelleting, so the consultation again can go through your labs, or you can, through insurance, or if you want to just pay all cash, your lab $150, your consultation is $150, and then the pelleting itself can range from $300 to $500 if you're a female. For male, it's a little more, $400 to $600, because of the pellets needed, and it lasts a little. Sorry, 6 to 7. So men are a little longer than females, but they require more pellets. Their pellets are a little bigger, so yay for females. But again, these symptoms can be relieved for you by this procedure. So again, I'm going to show you that checklist one more time, and I'm also going to show you the nutraceuticals that Kelly was talking about. So again, if you have any of these symptoms here, take a look here. We can definitely be able to help you there. And I'm going to show you the nutraceuticals she was talking about. She talked about DIM. That would be right here. Here you go. You have your probiotics here, your ADK, your iodine, and your omega-3. So these are some nutraceuticals she may recommend when you come in to see her. Both she and Dr. Downs can do this procedure, but Kelly is amazing. So ask for Kelly. But yes, again, so here's the nutraceuticals. Now, these are not included in the cost of pelleting. So these would be an extra cost. Honestly, they range a little bit, but they're not too expensive. They range anywhere from, $50 to $100. So, and they do last quite a bit. Like this one right here has 60 capsules. This one is 60. Again, you can see vegetarian. So if that's something that you are a vegetarian, these are going to be great for you. Okay, so they're getting all set up here. And we're going to get started in a second to actually have the procedure. And again, for when she gets her thyroid, she is going to get a prescription for that. So you can put that through your insurance if you would like. Or you can pay out of pocket. That's up to you. But that she will get a prescription for that to go to the pharmacist to pick that up. And more than likely. And again, what did you recommend? The DIM?
DIM and ADK.
And ADK. So these are the things that she is for sure going to need. Now, I know I love probiotics. I mean, they're fantastic just to take every day to help with, any type of, got a cold. I mean, this is going to help you, any type of sickness. Probiotics are fabulous. Okay, so here are the 3 right here that she's recommending for our patient. All right, so are we ready, ladies?
We're ready.
Okay.
I'm gonna get ready to numb here.
All right, so she's going to numb her. I'm going to get nice and close. She's just going to get really close. It's going to be right here. And again, this is on the back side of her buttocks. She want me to switch you positions?
Yes.
Okay. I like to get up and very close.
I just kind of mark the site with my finger here. Leave myself a little layer mark to go by.
Yes, Renee, the supplements would, it's not part of the package. You have to pay out of pocket for that.
Okay. Little sting and a burn.
So this is just numbing her. You're doing great.
And Stephanie will get that skin prepped up for us. my tray over here.
This is just to clean the skin off, Patty.
How you doing, Patty?
Good.
Did it hurt any?
Not really.
Well, that's good. Glad to hear that. And Renee, that would be, they're $7 around $50 each, usually the supplements. They range, the nutraceuticals.
From 19 to 20.
Yeah. Some are around 40 is the usual cost.
A piece, so I want to point that out. It's not a package deal.
They're all individual.
It depends on what you need, what your labs say. That's the big factor here, is what your labs draw.
Renee should have come with me.
She should have. So we're going to get ready and go ahead and pellet her. And Kelly's going to explain what she's doing here.
I got her.
Yeah, I can do it. So this is a pretty simple procedure. Oh, Renee says I'm with you, sister. This is a pretty simple procedure. I mean, this only takes 5 minutes, if that.
I'm going to test the skin first to make sure you're numb here. Anything there? Anything sharp? You let me know if you're having any discomfort.
Now, what is this you're doing?
This is a trocar, so this is what's going to allow us to deliver the pellets underneath the skin. And so this is the estrogen.
And how much is that, do you know?
This is 12.5 milligrams of estrogen. And these are the testosterone pellets. Each of them are 87.5 milligrams.
So awesome. Because I remember when I saw this in training, but I didn't get like this up close with it. So it's just amazing. And she's just pushing that through.
Just like that, we're done.
And she's done. How easy is that procedure? Super easy. And this is I feel like a life-changing procedure. I mean, hopefully, you know, all of Patty's symptoms go away and she's feeling better, more energy, so can sleep better, hot flashes, all of that. We're done. Can you believe it? She's gonna bandage you up and you're gonna be good to go. Someone said, no way, awesome.
So this is just a mastisol that helps that it's sticky so that dressing can stay on.
And Stephanie is doing such a great job assisting.
Stephanie is my right hand.
If you have any
Knows
questions,
a lot about it, and she
yes,
does a lot of the follow-up calls with patients, so she's very knowledgeable and does awesome.
yes, so if you have any questions, you can always give Stephanie a call. She would be more than happy to answer them for you.
And this is that occlusive dressing that we leave on just for the day. And you can shower, just no baths. All right, you are all set.
Okay, we're all done. So Kelly, can we do a quick little wrap up before we go out? So again, let's kind of explain what we did and how can a patient get this procedure done?
So basically, you know, it starts off by patients just, you know, recognizing that they're having symptoms, that they want to feel better, and that they kind of read a little bit or heard a little bit about hormone replacement therapy and bioidenticals. So basically, this is a form of hormone replacement that's been around for over 80 years. It's been the most researched delivery system for replacing hormones. It's been, like I said, there's been 80 years worth of research. There's a large following. BioTE pellets. We have nationwide providers that pellet 25,000 a month. So this is, you know, a very proven science and patients are feeling better, they would be coming back. So it starts with you just kind of recognizing your symptoms. Then we could, have you come in, get a lab slip, or come in and have your blood drawn here. It starts with the lab work. That enables us to identify where you're deficient and where you might need replacement. Once that's done, we have you come in for a consultation so we can kind of talk to you a little bit more about hormone replacement, what the benefits are for you, just in symptom relief, but again, against protecting against certain types of cancer, Alzheimer's, dementia, cardiovascular disease, breast and bone health. So it has protective qualities to it as well, and it's preventative, which we don't do a very good job of here in the United States, is preventative medicine. So then once we're able to identify what you're deficient in, we can replace it through pellets and through nutraceuticals, and just kind of optimize your hormones so you're feeling better, living healthier.
I know one big question someone asked is, what if they're on a patch right now?
So if you're on a patch, that kind of changes how we would do your lab work. Basically, you have to be off of your estrogen and testosterone to do your lab work. So we have instructions for patients that need to come off of their synthetic hormones. Basically, if you're on a patch or a cream, you need to stop that 24 to 48 hours prior to your lab work. But then once you can go back on it until your consultation. Then once you're pelleted, we usually transition you off of your patches, your creams, about 3 days after your pelleting.
Okay.
For males that do injectable testosterone, it's about a week that they can transition off before the testosterone is present in their blood system.
And again, can you go over the pricing one more time, or I can?
So females are $300 for the procedure. Your consultation is usually run through insurance, and insurance does pretty well covering it. It just depends on your copay if you have one. Lab work, if your insurance covers your lab work, that's certainly something you can take the requisition to any of your preferred lab draw facilities, or we can draw it here if you just want to pay out of pocket, or that you're going to have a large deductible. We charge $150 if you have your blood drawn here. Consultations, if you don't have insurance or you want to just pay out of pocket, are $160. Female procedures are $300, and that is not covered by insurance. Male procedures is dependent on the amount of testosterone they're given. It's $600, but if they go over 2,000 milligrams of testosterone, it's $700.
Awesome.
Typically, male procedures will last a little bit longer, so they might go beyond the 3 to 4 months that women have to get repelleted, which is why the cost is so different, and because of the amount of testosterone they get is triple the amount that women usually get. So.
Awesome. Well, thanks, Kelly. Thanks, Patty, for letting us pellet you.
Thank you.
And you have a patient that says that she cannot wait to come in and see you.
Great.
So make sure you call, and Stephanie can answer any questions you want. This is Stephanie. Say hi, Stephanie.
Hi.
And I'm going to get out of here so they can finish up. So come on out with me, you guys. And again, the reason our staff is so friendly because everybody's pelleted. So that's another reason why. But again, so if you guys are interested in BioTE, all that information is on our website, thecenterpc.com. So if that's something you're interested in doing, give us a call. We can have you come in, do your lab work here. That is, again, a $150 charge. Or you can go through your insurance and we'll get that all set up, send you your labs. Now, if you want a little bit more information, we are doing a seminar. So we're doing a seminar on June 8th. Okay, June 8th from 11 to 1 p.m. at our facility. Kelly will be here, Dr. Downs will be here, Stephanie will be here, Jessica, everybody, Levine, everybody will be here to answer your questions. Again, we can also do lab drawings then too, so if you're really interested, you want to get it done then, we can do that. So again, that's June 8th at our facility in Mishawaka, the Center PC, from 11 to 1 p.m. So June 8th, 1 to p.m. And I'll make sure I put that on our Facebook for you guys. And again, if you have any questions, I'd be happy to answer them. Thanks so much for watching. We'll be back next Friday. I have a really fun procedure to do next Friday. I'm so excited. So again, have a great weekend, you guys. If you're interested in Spring Clean deals, they end today at 5 o'clock. So make sure you give us a call. Bye, guys.